Hi, I'm Nancy. Welcome to Mindful Yoga. Today, our theme is the sacro-iliac joint, the joint that joins the ilium on both sides, which is the hip bone, the upper part of the hip bone, an outer and upper part of the hip bone, and the sacrum, which is a wedge-shaped bone that comes down below the lumbar spine. So we have the five vertebrae of the lumbar spine, and then we have the five vertebrae of the sacrum, which are actually fused together after about age 25. So I wanted to show just a few pictures here. Here you can see, wait, oh, here you go. Here you can see the ilium on each side, the hip bones, and then this is the sacro-iliac joint on either side, and here's the sacrum here in the middle, and the lumbar spine would be up here. It has strong ligaments. I'm going to mute all once again. It has strong ligaments around it, and here you can see an anterior view, and you can see that there's ligaments between the sacrum over to the ilium and farther down, and then the posterior view, you can see that there are ligaments going over towards the ilium and then down towards the ischium, which is down below. So it's really well held in place by ligaments. It's not so well held in place by muscles. Only one muscle, the piriformis. And we'll be working on that some today because of that. So let's take a seat. And as we take this seat, be particularly aware of the evenness between the hips, perhaps bringing your hands to the top of the hip bones on the sides and making those neutral, equal. And then running the hands down from the waist down, getting a sense of five lumbar vertebrae going down. And then as things go in a little slightly, you're in the vicinity of the sacrum. The relationship between the sacrum, which is part of the spine, and the pelvis, the ilium, the hip bones, is very important. And what happens often is that those get separated. And even in yoga, we can overstretch those ligaments and bring more separation in between those bones. So as we sit here, we want to make sure that the sacrum is right in line with the ilium in the back. So the spine and the pelvic bones on the sides, just right in line with each other. Lifting the spine up from that, long through the back of the neck, keeping the nice natural curves of the lumbar spine, the thoracic spine, and the cervical spine. And then allowing our attention to settle into the breath. Noticing the air coming in through the nostrils. Coming down through the throat into the bronchial tubes. And then coming farther down into the lungs, out into all the lobes of the lungs. Like a flower blooming in the lungs. Noticing the contraction and extension of the diaphragm underneath all of that. And allowing the belly to relax. A little relaxation through eyes and jaws and shoulders can help the belly relax. Feeling the breath, filling the whole torso. And bringing the attention particularly below the belly button, an inch or two. Feeling the in and out as the diaphragm moves. Bringing our attention down here into the pelvic bowl, the area that is good to have your attention in if you're meditating. And if you're physically moving, the core of our body. And then bringing the attention across to the back of the pelvic bowl, just opposite of the intertube below the belly button, and come an inch or two below the top of the pelvic bowl in the back. This is called in Qigong the gate of life. Feeling, imagining, minding the breath as it opens and closes that area in the back. Staying with that, or perhaps allowing on the inhale the air to come up the back of the spine, back of the neck, over the skull, to the tongue against the front teeth. On the inhale, and on the exhale, letting the exhale come from that tongue down the front central part of the body, to the front of the spine, down around the pelvic floor and back up, curling up to the gate of life once again. And from the Radiant Sutra, all this talk of purity and impurity, these are just opinions. Beyond them are the miraculous energies of creation. Rays of light from 1,000,000,000 suns illumine the altar of your sky. Rolling blue-green oceans sanctify the air you breathe. In this moment, you are inhaling their blessing. Who are you to call any of this pure or impure? Find the center around which everything revolves. Stand here and be flooded with joy. Joy for the air we breathe, the water, the fires of the sky, this precious life. And now opening the eyes, turning the shoulders up towards the ears, feeling those shoulder blades gliding around the ribs in the back. Then bringing the shoulders up to the ears for 3, 2, 1, and then let them come down, relax down through shoulders, down through arms, down through the palms of the hands, face also, eyes, cheeks, mouth, relaxing. And once again, shoulders come up for 3, 2, 1, and relax down. Head, shoulders, arms, and down into the belly. Now let's take an easy side bend, aware that the pelvis is staying firm. So the spine, the sacrum, and the ilium, the pelvis, are staying firm, not moving in relationship to each other, and very symmetrical. Now, much of what I'll be saying this morning is preventative, or it can help to heal. There are many of us who don't have ostensible problems with the sacro-iliac joint. Coming back through center, bring one hand over to the opposite thigh, other hand back behind, just a gentle twist, and this is from the waist up, so keeping that relationship between the spine and the pelvis, very stable there and back. And arms come out, come around to the other side. I have a fairly healthy sacroiliac joints, I think. However, I get some inflammation there sometimes. And so mine is preventative with some potential problems on the horizon, which maybe is where some of us are at. So this is just some cautionary words as to how to do yoga so that we maintain this relationship of symmetry and not too much separation between the spine and the pelvis. Arms go out to the side, and once again twisting through the thoracic. So it's the thoracic twist from the waist up, Eyes just follow along the body. Not a big twist in the back. Located mainly in the thoracic and not even much in the cervical, right? Because our eyes are just following along. And coming back through center. Inhale as arms become wide, soft through elbows and wrists. And then exhale in, back arches back. Inhale and exhale. Opening up those facet joints between the vertebrae, warming and hydrating that synovial fluid, giving some nutrient to the discs, the cartilage between the vertebrae that don't get a lot of blood flow. One last time. Open up and come together. Now, if you brought a block or a pillow with you, bring it between your knees. And if you don't have anything, you could just bring your two fists in between your knees. Sitting so that you're firmly on your sits bones. And if you need hands on either side of your hips, that's fine. We're going to be pushing together. So this is an isometric contraction of the knees and of the inner thighs, the adductors, in towards that block. Knees are pretty much parallel, thighs parallel with the hips. For 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So this is one of the recommended strengthening areas that we can have to strengthen around that those sacro-iliac joints. Now, coming back to the twist for a moment, we often extend one leg and we bring the other foot up. Let's extend our right leg out and bring the left foot up. And I usually say you can bring it over, and we bring one hand on or one forearm even around the knee. So if you're having trouble with sacroiliac joint, this is not a good idea. Stay loose with this hand. Let it be down here on the shin calf area. Other hand comes back behind. Now, to keep the pelvis and the spine together here, we can extend forward through that extended leg. So I'm moving my hip joint forward a bit as that extended leg moves forward. So that already I'm bringing a twist that's keeping the spine and the pelvis together to the base of this twist that we're going to be going into. So I'm already getting a little twist there. And then imagine turning through your organs. So rather than the spine, think of just gently turning the organs slightly over in that direction, keeping loose with that front hand. And then come into the spine, turning the ribs lower, ribs higher, and the chin around. So the twist in the spine comes really at the end. This is advice from the sacro-iliac point of view, which keeps the sacrum and the ilium together. Then releasing that, left foot extends out, right foot comes up, and it can come over or not. You can see if you bring your hand, I mean, just to show the opposite, if you bring your hand around there and push hard on the thigh or your forearm, you feel things happening in the hip, and you're pulling that ilium away from the sacrum when you do that. That's the explanation that I've been learning. And so that's why a looser hand here can be beneficial. Now let's extend out through that left leg, and the hip socket is really coming forward. So you're a bit horizontally diagonal, but you're keeping the spine and the ilium together, the spine and the pelvis together. We're lifting up through the backbone, as we always do on a twist, and then turning through the organs. Now beginning to twist ribs, lower, upper, and chin towards the shoulder. So keeping the sacro-iliac joints safe. So twists, deep twists can be difficult with sacro-iliac joint. Another thing in yoga that we sometimes do is have the feet wide out in front of us. So bring them out and wide in front. And I always like this one where you bring your foot up and the foot is nestled against the inner thigh of the other leg. If you have a perfectly healthy sacroiliac joints, then you're fine. But this, again, because we twist and then we come over, we are making some separation between the sacrum and the pelvis. So some advice is to bring the foot down a little bit farther around the knee or around the calf area. So you're loosening up in that way. And then, let's see. We want to keep that symmetry in the pelvis. Put the foot on the calf. Let the bent leg side of the sacrum move forward with the spine. So moving as if you're moving from this bent leg hip over enables there to be less movement between the spine and the pelvis. So in this case, in fact, that bent leg side comes back just a little bit in order to keep symmetry and togetherness in relation to the sacrum and the pelvis. And then sometimes we do a forward fold here, right? And so we want to keep the pelvis and the sacrum together as we come down over. So turning through the chest, feeling back there. Are the lumbar spine, the sacrum, and the pelvis together, moving through the ribs and coming over. So just making some small corrections or changes in order to enable us to do much the same thing. Let's try the same thing on the other side. So this time, rather than tucking up far inside the inner thigh, we'll bring the foot to the calf, come forward on the sits bones, long through the spine, and that hand of the extended leg is coming down. Let the hip of the bent leg come forward a little bit. Keep your weight over there, and the intention of bringing this arm up and over and reaching from that hip on the right, in this case for me, the bent leg side, and then coming up and over. Reaching from that hip, bottom of the hip, the sits bones of the bent leg side. And then coming into a forward fold in this way, turning the heart towards the toes, feeling back there. Are things in union with each other, and then coming forward. Let's bring our feet wide, hands are on the knees, and let the chest come forward, and then chin come to chest, arching through the back, opening up through the spine. And you can feel the sacrum moving back and forth, the lumbar spine, the pelvis. You probably, if you want to protect the sacro-iliac joints, you don't bring your feet as far apart. Keeping that bond between the spine and the pelvis. Now bring your hands back behind, and we're going to do a windshield wiper. And we bring our feet fairly far apart for this. Let the whole hip pelvic structure come up if you're worried about sacro-iliac problems. And the knee comes over, so the whole hip structure, or pelvic structure, I really should say, comes up and over. And when we do a supine twist, which we'll do at the end, lying down, that's the same idea. We bring the hips over so that they're almost vertical. And there's this even line across the back of the pelvis. And then bringing the arm around as we do. But if there's any pain for you through those sacro-iliac joints, just back off. And next time we come around, come down in a full body twist. Let's be aware of what's happening back here. Our knees are pretty loose, and I'm feeling a fair amount of evenness across the sacrum and the pelvis. But of course, if we force ourselves down more, we could have more separation. So being respectful of the sacro-iliac joint, aware of it, and if it's not bothering you, great. Then your ligaments are strong, your muscles are strong, and things are working well. If there is some discomfort, then being aware of keeping this evenness in the back of the pelvis and not forcing, particularly in twists and in forward folds. Alrighty, let's put our sitting equipment aside, and we're going to come down into a lying position. So I wanted to, the piriformis is a muscle that goes from the front of the sacrum across, it's horizontal. Piriformis comes across to the top of the femur, or the top of the thigh bone. As you come back, just sink down, bring one knee up towards the chest and just give it a hug. Feeling the breath as the belly meets the thigh. And then the other knee up. There is movement here in the hip socket, but you should feel contact, sacrum, and both sides of the ilium, the pelvis, in the back. Then bringing both knees up and giving them both a hug. This is a beneficial movement for the sacro-iliac joint. Breathing there, one more breath. And then coming down, let's bring the ankle of one foot up onto the thigh of the other, just above the knee, and then lifting that knee and giving some support behind the thigh. And this is the typical piriformis stretch, right? The figure 4. Not straining it, just being relaxed in it. So again, the piriformis is the only muscle that gives stability to that side joint. It externally rotates the hip, and you can see how you, with that figure 4 leg, you're externally rotating your hip. So it's important to keep it relaxed, enabling it to relax. At the same time, it's important to strengthen it. So we'll be doing both of those. This is a stretch. And then switching legs, other leg becoming the figure 4 leg. As you lift that opposite leg up a bit, just finding the place that is right for you to give some stretch to that piriformis. The sciatic nerve runs right behind the piriformis muscle, so it's vertical and the piriformis muscle is horizontal. And so we do need to keep it loose because we don't want it pressing on the sciatic nerve. The piriformis muscle also aids in adduction, that pushing together of the thighs and the knees, and it stabilizes the pelvis while we're walking. So very important to the whole structure, our whole core and movement. Now, Bring your feet down and take your block or pillow, or you could use your, if you lift your knees, you can also use your two fists in between if that's what you have. If you have a block or pillow, leave your feet down on the mat, knees are bent, and then you're pushing in between your knees, and the block, if anything, is coming up into the thighs a bit, and I'm on its narrowest setting. And people have different size hips, so decide what setting you want. Maybe you want the second largest size, down if you want the longitudinal. And pushing in, strengthening those adductor muscles for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Now keeping the block there, or the pillow, raise the knees, and then we're going to turn the hips over, keeping the pelvis and the spine together, sacrum and ilium moving together as you roll across. So you're rolling across to about 45 degrees, the whole pelvic bowl is rolling without separation between the pelvis and the spine. Rolling back and forth, kind of caressing and massaging the sacro-iliac joints. Then coming back through center, removing the block or pillow, and we'll let the thighs, the knees open within your range of motion, and then come together and press lightly, open, and come together, press lightly. So this is activating the piriformis muscle. And it's also giving some stimulation to the sacro-iliac joint. We don't want to move it in the wrong way, but we want to move it. And we want to feed those ligaments there, which can become overstretched. But we want to give them the food and oxygen they need. So out and in. 2 more times. Now extend the left leg out and bring the right leg straight up. And just holding this, feeling kind of wiggling your hip, bringing your thumbs to the top of the ilium, the top of the hip bone, seeing if that's neutral, that is, that's even across. Feeling that even as that hip socket is bringing the foot and leg up, that there's evenness between the sacrum and the ilium. And then bring it down, and the other side, holding it up. Coming back to your breath, 2 breaths here. And bring it down. Bring a bend to the knees, soles of the feet are on the earth, and head is back comfortably. We're going to come into a pelvic tilt, which is a good strengthener for the piriformis. So as we lie here, the small of the back comes down towards the mat, and then the small of the back lifts up. The tailbone, the sacrum are going back and forth here. And there's a little symphony being played between the lumbar spine and the sacrum, which we'll talk about a little bit more when we stand. But they act in relationship to each other. And so we're not really tucking the tailbone, we're just, by moving, allowing the sacrum to move in relationship to the lumbar spine, and it moves anteriorly and posteriorly. Now we'll come into a bridge, which is a good strengthener for the piriformis. Shoulder blades come in behind the body, elbows come in towards the waist. Press into the feet, lift the hips, glutes are strong. Hands might interlace underneath the buttocks, long between the knees and the shoulders. That length is a really nice stretch through the pelvis. We don't think about the pelvis much in this. We think about the glutes. We think about the legs, the back muscles that are hard at work here. Strengthening the glutes is always a good thing for the sacro-iliac joint, which we're doing here. And here we're strengthening the piriformis as well. Bring it down, take a breath. Tuck the shoulder blades in, tuck the elbows in, interlace the fingers, press into the feet. Get that feeling of the femur bones, the thigh bones, coming right into their sockets, right into the pelvis. Perhaps sensing that the sacrum and the ilium are just right together on either side, right in sync with each other. Bring it down one more time, up and down. Now coming up to a seated position for a moment, we'll do the boat pose, another good piriformis strengthener. Bend your knees, bring your toes to the mat, lean back a bit with an open chest, eyes forward, shoulder blades down towards the waist. Lifting the lower legs and feet. Maybe you keep your hands behind your thighs or you bring them out to the sides, palms up. Strong through the quads here, strong through the piriformis, so as abdominal muscles. And sometimes I twist here, not something you want to do if you've got some soreness in your sacro-iliac joint, just these extensions and flexions that are vertical, straight through the body, back and forth, and bring it down. Now bring the feet just a little wide, not as wide perhaps as we often do on a up plank. I often start this with a swing of the hips back in between or towards that area in between the hands. The fingers of the hands are pointed forward towards the heels. And then challenge, if you'd like, to really tighten those glutes and come into an up plank. And here I'm saying that so for the sacro-iliac joint, to keep that strong union between the pelvis and the spine, feet not too far apart is a good thing, and keeping a very strong glute relationship with all of that for 3, 2, and 1. Come back down. Let's come back into boat for just a moment. Great abdominal and quad strengthener. And bring it down. Then we're going to lie on our sides. So coming down on one side, let's start with the clam. So here I'm having my forearm underneath the shoulder. My shoulders are up. Feel the comfort of this pose. Wiggle the hips around. Check back here. Take your hand. Go across the lower back. Is there evenness between the ilium, the hip bones on each side, and the sacrum, and the lumbar spine and sacrum in the middle there? And then I like to bring my hand to the top of the top knee, side of the top knee, and then push up and come down. So I'm pushing, I'm pushing up with my knee, I'm pushing down with my hand. Again, a good piriformis strengthener. For 3, 2, always modifying it as you need to, and bring it down. Now bring knee towards nose gently. Let the hand run down the front of the bottom leg, and then you might pull the foot back, but if you've got some sacroiliac sensitivity, you might just let the knee be bent and the thigh coming straight down from the hip bone, or if you want to, getting that foot back there and giving a stretch. So the point of this is the hip flexor, opening the hip flexor, an important thing to everything about the pelvis, and some glute activity there as you open up through that hip joint in the front. But for the sacro-iliac joint, we want to be aware of the movement that is occurring. If you bring your hand back behind the body and just bring the knee down, you can feel the movement. So it's the hip joint moving, but we don't want to have the sacrum moving greatly or much at all in relationship to the ilium, the hip bone beside it. And then bring that down. A hip lift, which we sometimes do, is also good for the piriformis. So knees are in a gentle V. Hand comes across the chest with a soft fist, and we lift the hips up. 4, 3, 2, and 1. This arm on top can come up if you wish, or stay with what you were at for 4, 3, 2, and 1. Option of a side plank here, as legs might straighten out and feet might stack on top of each other. Hand might come across the chest or be up for 3, 2, and 1. But notice in that side plank, everything is together here across the back pelvis. Lastly, we're going to lift the leg. So bringing the head down, resting in the crook of your elbow. Both legs are more or less straight. The other one can be, under one can be a little bit bent, and then lifting just 6 to 8 inches. Strengthening the side of the pelvic bowl, the gluteus medius, up and down, making sure that you aren't twisting forward or twisting back. A direct lift. And again, you might bring your hand back there to the sacrum and back of the pelvic bowl. Is everything even? And then switching over to the other side. And we'll start with the clam. Forearm again is under the shoulder. Gentle V with the knees. Lifting with the knee, pushing down just gently with the hand. Strengthening glutes, strengthening piriformis. 3, 2, and 1. And coming into the quad stretch. Knee comes up towards the nose. And then let's not have so much torque right now on that back leg, but rather bring our hand to the back of the sacrum and make sure that things are sticking together back there. So bringing the knee up and then bringing it down. I'm just feeling there across the back bottom of my pelvic bowl, just to see how it all is working together. And then if you want to have a good stretch with holding the foot and opening that front hip joint, that's great. And relax it. Now let's do the hip lift. Arm comes across the chest. Soft fist in the eye of the shoulder, hips lift. Stay here. You might bring the arm up above for 4, 3, 2, and 1. You might stay with either of those, or you might try out a side plank, lifting the hips. Arms might be up, arm might be across the chest for 4, 3, 2, and 1, and bring it down. Then lifting our leg from the side, the head comes down into the crook of the elbow. Legs are pretty much stacked on each other. There can be a little give in that bottom leg. and then lifting the leg up 6 to 8 inches, up and down. 6, 5, 4, 3, 2, and 1. Very good. Take a moment just to relax here. Maybe you draw your knees up and lie here in the fetal position just for a moment. Just relaxing down, giving yourself a pat on the back. You're here. You are caring for your body. You are in touch with the earth, with the stars, with the ocean, and the air outside and inside us, the miracles of creation. And our bodies are part of that miracles of creation. They're really amazing when we start to study them. We're going to come into a prone position. So rolling over. And coming into a Sphinx pose for a moment to get settled. Rolling around a little bit on the front of the pelvis, the hips, making them feel comfortable, stretching back a little bit through the legs, bottom tips of the shoulder blades resting down towards the waist. A little pull back through the fingers and back through the elbows. 2 breaths here. We can be assured that the spine and the pelvis are in line with each other now, unless there are major structural problems, which of course can occur. And then we bring the ribs down, the lower ribs down, hands come under the shoulders, elbows are bent along the sides without pushing into our hands, but pushing into the top of our feet and engaging up along the legs and into the hips, into the pelvis area, the core, the abdomen, the piriformis, and lifting slightly, just as much as you can through head and shoulders for 4, 3, 2, and 1. And then, if it serves, bring the arms wide, fingers are pointing backwards. You're like a flock of geese flying through the sky. Thumbs are up and palms are open to the outside, away from the body. The whole back of the body is lit up here, supporting you. And then coming down. Bring one arm, let's see how to do this. No, leave the chest back down and bring a hand back so that you can feel the glute on one side. Squeeze that glute for 4, 3, 2, 1. Can you feel the activity in that glute? Then bend the knee. And continuing to feel that glute, you're bending the knee on the same side as the glute that your hand is on, and then lifting slightly or stretching back. This is a good glute exercise. And it's also a kind of test. Is your glute turning on? Because sometimes they give up and they don't turn on too much. So squeezing your glutes 10 times once a day is not a bad idea. And then coming to the other side. Bringing the other hand back onto the glute, squeezing the glute, 4, 3, 2, 1, bending the knee. This ensures that you're using your glute as you lift slightly up through the thigh and knee. 4, 3, 2, and 1. Now bring the forearm, let's bring the right forearm across underneath the shoulders. Bend the left knee up. The right hand comes back, perhaps just yearning back towards that leg, or perhaps it takes a piece of clothing or the shin or foot. Stretching back from the hip, back through the knee, perhaps lifting slightly. Just stretching that side of the body and letting it come down. If there's any pain, back off. Left arm comes under the shoulder, horizontal across under the shoulder. Bend the right knee, the right fingers, yearn back through the air towards that leg. It may take clothes or ankle or foot. Then reaching back from the hip, stretching back through the hip, through the knee, I'm sorry, hip down to the knee. And then let it come down. Have both forearms underneath the shoulders. Stretch back through one leg. And then stretch back through the other leg. Now, if it serves you, bring the ribs down, both knees bend. Hands come back, and again, they may just yearn back or take part of clothing, and a little lift through the head and shoulders. Or you might take the feet. Now, if you're doing this, we're going to be coming on S1, which is the top sacral vertebrae, as we come into a bow position. And then come down. Bring your fingers, feel the lumbar spine coming down from the waist, 5 lumbar spine, and then feeling the first sacral vertebra. And this is the center of this bow pose. So we want this top sacral vertebrae to be coming down towards the earth as the lumbar spine and the legs lift up. So once again, coming into that, if that serves you, for 3, feeling that center in the top of the sacrum and bringing it down. I know that's not for everyone, but let's come up and come back into your version of child's pose. If your knees don't bend so far, you might just be pulling back with not so much bend in the knees, or you might have the knees bent with the hips coming towards the heels, pulling back, feeling that nice stretch through the sacrum, knowing that you've got a good bond here between the pelvis and the sacrum. And coming forward. Okay, I'm going to skip a few things here. Let's come into downward dog, because I want to stand here and talk a few things through. Let's have a downward dog. Downward dog is great. The vertical movement here and the forward back movement as you come down into plank and back up into downward dog is very straightforward, no twists. And the spine and the pelvis are just moving together nicely. Then let's step forward, bring the hands back towards the feet. Bring our hands to the front of the bottom legs, long from the hips up through the crown. Then letting the bellies come down to the thigh, arms come wide, eyes forward, and we come up into mountain pose. So coming into mountain pose here for a moment. Bring your hands to the crests of the ilium, so the tops of the hip bones on the sides. And again, feeling the neutrality of the pelvis, so the evenness between the hips. Now, as I mentioned, the sacrum is not a straight bone. It goes actually at 30 degrees. So the lumbar spine comes down, and then when we're standing, that wedge-shaped sacrum actually kind of fits down in between the pelvis at a 30-degree angle. This is the way it should be. So it kind of hides in there and goes forward a little bit. Then if we just have our feet underneath the hips, and hips come back, we're coming down into chair pose. Now that sacrum is coming backwards a bit. So as we come up, it's coming forward, fitting into the standing pelvis, and then it comes back, and it's not so tightly against the ilium on either side, and comes up. So might be ironic, but our standing pose is really the place of best stability for our sacrum in relation to the ilium and the pelvis. On the other hand, we want it to be able to move, right? So this is that rhythm between the sacrum and the lumbar joints, the lumbar sacral rhythm, as we stand up and sit down in chairs or sit down in a yoga chair, which is a chair of air. And we're holding it down here, but this is not the most stable place for the sacro-iliac joints. Bringing it up, you're in a much more stable position. And sometimes when we're in this mountain pose, I say, bring the energy up through the feet, through the legs, a little turn in through the inner thighs, and then bring the sits bones together. So we're really making a very nice tight base for the sacro-iliac joint when we do that. And then I often follow that with the front of the ribs coming down, bottom front, and the back bottom of the shoulder blades coming down towards the waist, and a little bit of tuck in both of those, especially in the front there. So we have some strength here around in the chest area, and then we have this strong bond as the inner thighs turn in a little bit, and the sits bones come together. It's really a squeezing of the glutes as well. And then relaxing down, letting the body hold itself back up, having faith in the connective tissue of our body to hold us up. Bring your hands back behind the sacrum or the pelvis. Your heels of your hand are on the top of the pelvis, fingers are going down, shoulder blades squeeze together, glutes are nice and tight here, and we're extending through the lumbar spine at the same time that sacrum is tucking in farther and coming a little farther to the front, opening up from pubic bone up through collarbone. Bring it up, squeeze glutes together, sacrum is going forward a little bit more, shoulder blades coming together, just gently opening up in the front of the spine and coming back up. Now when we forward fold, and we're not going to do a big forward fold, but just bring the hands down the front of the thighs, and the torso comes parallel to the earth. And here, the sacrum is actually coming out posteriorly to the back. So as we come up into a standing position, the sacrum is tucking in into a very stable position. And then as we run our hands down and torso becomes parallel, if we do a full forward fold, then there's going to be less stability. And you know, if you've got healthy ligaments and healthy muscles and a healthy joint, then you're fine. But if you want to watch out for a little bit, we won't do as many deep forward folds, or we'll be very careful about them. Let's do a vertical swing. This is a great one. Keeps the sacrum and the pelvis all together. Knees bend, hands come back behind, and then they come up in front of the chest at first, opening up through the palms and the fingers. This is a nice opening. Feeling that opening coming through the forearms, the elbows, under the arms. Nice for lymph circulation. The lymph glands behind the knees and in the groin, under the arms are all getting some opening here. Feeling the relationship between the hands and the feet. Whole body opening. That sacrum happily going forward and backwards, coming into a very stable position as we rise up, reaching back as we bend our knees. 4, 3, 2, and 1. And bring it down. Let's just do hip circles before we end. So if we're being particularly careful of our sacro-iliac, we want to make sure, as we've been saying, that things are even and together back there and things are symmetrical. Well, a hip circle is never entirely symmetrical, right? It's moving. At the same time, if it's a smaller one with feet more directly under the hips, then you have more unity back there between the sacrum and the ilium. And you can feel if you bring your feet a little wider, there is more movement back there. And if the hip circle becomes bigger, a little more movement back there. So you have to judge where are you with your sacro-iliac joint in relation to these hip circles. Let's start with feet again under the hips with a small circle, feeling back there in the sacral area that there is a great deal of bonding among the bones, ligaments. And then if you're healthy and want to feel it as you have a larger circle, you can feel the glutes entering in there. Piriformis is active. For 3, 2, and 1. Let's come down into a lying position. We're going to end with a supine twist, practicing that idea that the whole pelvic structure will be moving together. So as we lean back, right leg stays out, left leg bends up. Lift the hips and bring them over to the left a little bit. The left leg comes up on the thigh, the right thigh, and the right hand draws that knee across. As you draw that knee across, let the hips roll. So you're really on the side of that right hip, and there's a verticality between all along the back of the pelvic bowl and between the spine and the pelvis. And then forgetting about all this technicality, just relaxing into that twist, letting there be relaxation in the pelvic bowl, down behind the thigh, the knee, the calf, the ankle, softness in the bottom of the foot, and between the toes. Then rolling over to center, left leg extends out, right foot comes up beside the thigh, lift the hips over to the right slightly, right foot on left thigh, and the left hand is going to draw that right knee across, let the hips roll, get that verticality, that union between the sacrum and the ilium on both sides. And then again, relaxing down through that leg, relaxing behind the waist, up the spine, behind the heart, the back of the neck, under the occipital ridge, around the skull, the forehead, evening out any furrows in the brow, eyes soft, capillaries and muscles relaxing around the eyes, the balls of the eyes relaxed, and bringing that softness back into the brain. Down through cheeks and tongue, lungs, heart, stomach, liver, and down into the intestines. Letting go into the earth, into the miraculous energies of creation. And rolling back if you'd like, and just take a moment to let everything go down, down, down into earth. The attention going to the center of the body, the pelvic bowl, finding that center around which everything revolves, where we can be flooded with joy at life. Namaste. Thanks for practicing. Hi, Eileen. Be well, everyone.
Thanks, Nancy.
Yeah,
Thanks, Nancy.
you're welcome. Bye-bye.